Good morning, Dr. Jaffe. We have a PERC customer that writes in that they have a family member who's dealing with, I'm going to put my air quotes up, dangerously low platelet levels. And I say that because I don't know for a fact, but that's what.
No, I can tell you what that means, but go ahead.
Okay. The doctor advised them that supplements will not help and to stop taking the supplements. So can you help us understand what the low platelet situation is about, and why would we stop taking supplements? And let's get some guidance here to help everybody out, please.
Oh, of course. And I was actually a professional coagulationist when I was at the National Institutes of Health, in addition to whatever else I was. And what that means is that I studied blood clotting, which means all aspects of blood clotting, including platelets and blood clotting factors and other things that influence the quality of blood vessels and how the blood flowed and what stimulated it to act and activate. And if you go way back to, say, 1972 or 73 in the Journal of Clinical Investigation, one of my earliest publications with Dan Dakin, and we showed that collagen activates platelets in a rather unique way. And others have then shown that what we observed for platelets is true for other things. So we were pioneers within a whole field of functional blood clotting. But now let's get to the question at hand. I believe that I am confident that whoever said the platelet count was low means less than 50,000. And yes, that is too low. Platelets come out of the bone marrow. They come from a big cell called a megakaryocyte. They are little fragments that break off. They are important in blood clotting. They are circulating neurovesicles. I would be happy to talk with a colleague about how to address these kinds of issues. And let me start with, whoever said to not take supplements obviously does not understand physiology. They may be an excellent conventional doctor who knows pharmacology, but clearly they do not understand that you could make this bad situation worse. Is this a failure of the bone marrow? Is this a failure, or is this an overconsumption of the platelets? There are actually several possibilities ranging from too much bad to too little good. And at a minimum, I would suggest an intensive supplementation program, maybe modified hyperalimentation using ascorbate to achieve peak and trough levels to see if you could clear, say, the toxic metals out of the bone marrow. If you happen to have a little bit of extra arsenic, cadmium, lead, mercury, or nickel in your bone marrow, your megakaryocytes might slow down to the point where the doctor says, we did a blood count, and gosh and golly, the platelet count is too low. Now, you'd like to have a platelet count of a couple of 100,000. You don't want too many, you don't want too few. It's always Goldilocks in my experience. Too many is too many, too few is too few. Ideally, you'd like to have 200,000 to 300,000 or so platelets. I'm pretty sure the definition hasn't changed, which is low platelet count means below 50,000. And that means you're at risk of bruising. That means you're at risk of not repairing blood vessels. That means you are at risk. Yes, I would recommend following our alkaline way approach. And yes, I would recommend working with a doctor who understands why that is an intelligent thing to do, as opposed to a colleague who, out of ignorance or for whatever reason, says take none a day. So yes, the supplements. Yes, sometimes these situations bounce back when you get the bad stuff out and the good stuff in, and sometimes they don't. It's a very individualized matter. If it is what's called aplastic anemia, which it might or might not be, you'll know it soon. But if it is reversible, you should get in there and reverse it sooner rather than later.